Good evening. I am Mayor Kim Carr, and I'm grateful that you decided to join us this evening to talk about COVID-19 and vaccines. This is a series that we decided was essential and desperately needed for our community based on all of the feedback that we've received from emails, text messages, phone calls from our residents wanting to know more about COVID and more about the vaccine distribution. So we will be doing these virtual town halls the first and third Wednesday of every month through April 2021. As for tonight, we will be focusing on COVID-19 vaccines, which are being deployed nationwide in an effort to immunize and protect our communities from this pandemic. We also are here to debunk a lot of the myths that we're hearing out in the community, and so that you can make an informed decision about that vaccine and what's right for you and your family. So tonight, I'm truly honored and grateful to have some very special guests with us. I have Dr. Regina Chincino Kwong, but who's more affectionately known as Dr. CK, from the Orange County Healthcare Agency. And we also have local HB resident Jeff Sherman here to talk with us about and progressing with dealing with this disease. So we're going to kick it off. But first, I would want to just let everybody know that this video will be uploaded onto hbready.com/town hall with the video and the PowerPoint presentation. So you're going to get a lot of information tonight. And so we know that you're not sitting there writing and taking notes. So you'll be able to go back, reference this, and then, take the information that you need. Also, during this conversation, if you have any questions, feel free to go to the comment box in either Facebook or YouTube, type in your question, and we have staff monitoring that, so we'll be getting those questions at the very end. But first, I want to just talk a little bit with Mr. Jeff Sherman, local HB resident, who is part of the 12%. So he is what we, when you're looking at all of the vaccines and people who test positive, we know that 12% are going to require hospital care. So Jeff, I'm going to go to the next slide. If you want to just tell us a little bit about your experience, the timeline, and what it was like for you.
Sure. Thanks, Mayor Carr. So I guess what it was like for me could be really summed up in one word: scary. There's so much that that isn't known about this, even at this stage, to the public at large. I'm a relatively young, 46 years old. I guess it's still somewhat considered relatively young, somewhat healthy, average guy who really wasn't worried about catching this himself. My biggest concern was that I was going to bring it home to my family. Unfortunately, I did bring it home to my daughter. My daughter did also contract COVID as well. Now, thankfully, she didn't end up in the hospital. I did. But, you go from a situation where you think, okay, I'm going to be okay, to, having a fever of 103.7 6 days later. And the day after that, testing your pulse ox and finding out that you've got, 82% oxygen levels, and that's way below what it should be. Correct me if I'm wrong here, Dr. CK, but I should be like in the mid 90s, if I'm resting, right?
Yes, you should be 96 to 100%.
Yeah. So at 82%, I didn't even realize at the time that I was low on O2. I just thought I was lethargic and worn down from having this disease. Thankfully, I had a pulse oximeter that somebody brought to me, and I used it, and I knew right at that moment I had to get to the hospital. So we got in the car, we drove down to Hoag, and they admitted me. My first stay ever in a hospital, I don't recommend it. They're nice places to look at, but you don't want to have an extended stay in one. They immediately put me on oxygen. They immediately put me on remdesivir. They immediately put me on a clinical trial, which I don't even know what it was at this point because they took me off of it 2 days later. I was on steroids and very quickly was placed on a high flow oxygen system just because I wasn't on a regular cannula like I'm on right now. I wasn't getting enough oxygen even still at that point. I was moved to subacute respiratory wing, which is a scary place to be at the very least. I can tell you too, from being in the hospital, and I was in there for from the 15th to the 26th, so almost 12 days. They let me go home the day after Christmas. I didn't get my Christmas wish, but having been in there that long and seen and talked with as many nurses and doctors as I did, they're really going through it with this, with all of us. I've known people who've gone away to active duty and have come back feeling effects of that and seeing what PTSD, if to use the term, if I can, is like. And I saw that in the faces of several of the nurses and several of the doctors who were working with me. I got lucky. I got rolled out in a wheelchair, and the nursing staff started cheering for me as they rolled me out. And I cried, and they cried. And I got lucky and got rolled down to the car to get picked up by my wife. And I'm back home. I'm still on oxygen 24/7. I'm still not out of the woods by any stretch of the imagination, but I'm at least, recovering with my family. That's honestly probably the worst part of it, is the isolation. You don't realize how lonely it is. Now, thank God we live in the day of, FaceTime and Zoom, what have you. So I was able to at least, get some time with my family that way, but it does not replace being in the home with your loved ones. And, it's just, you don't want it. Bottom line, folks, you don't want this. It's not just a cold. For some people, yeah, they get lucky, and I'm thankful for those of you, or to those of you that have gone through this and have been lucky enough to have it be just a cold for you. But don't let that fool you into thinking that this is any less serious than it absolutely is. All right. I'm lucky to be sitting here talking with you.
This really happened quickly for you. I mean, from when you first started having some symptoms to being in the ER. I mean, that happened so quickly. And so
one week.
And during that initial stages, so did you have mild symptoms and you were just kind of maybe a little bit run down, and then thought it just went from 0 to 60?
It started with a very minor fever, like just over 100 degrees, 100.3 on the first day that I took it. And I felt run down. And then I started coughing. And then the fevers really gained. The night before I went to the hospital, I had a fever of 103.7. I have never been more miserable in my entire life. You cannot get comfortable. Everything hurts. You're cold. You're shivering. You can't. I mean, my wife came into the bedroom and was really worried because I was just sprawled across the bed like a corpse. I mean, I couldn't even move. Yeah, it goes quickly. It does. It really does. And it goes up and down too. One day, like the day before, I felt okay. I thought maybe I'm going to get lucky. Maybe I'm going to come out the high side of this, Right. And even the day that I went to the hospital, I tell you, if I didn't have a pulse oximeter, I didn't think I was having a hard time breathing. I really didn't. I thought I was just run down.
And Dr. CK, is that pretty common for people who have COVID?
That's one of the most common symptoms that people describe. I'm just a little worn out. They don't realize that their oxygen saturation is down the toilet. We saw this with our first case in Orange County. Same story. I feel under the weather. I don't feel like I'm sick enough to see someone, but luckily they reached out to a virtual provider to ask for assistance. And even on that conversation, the patient was obviously short of breath, very similar to Jeff Sherman, very similar in age, very similar in story. Didn't even have the fevers and chills quite yet, but was just a little under the weather. Didn't claim they were short of breath, but felt run down. Luckily, the nurse practitioner who was assisting that patient on the virtual call immediately told him, don't even worry about coming to our clinic. Please go immediately to the hospital. Within days, that patient was actually ventilated, was actually put on a ventilator. And that was our first case here in Orange County. And there's many similar stories just like that. And sometimes people, they think they're in that area where they're getting better, like day 5, they feel wonderful, they don't have fevers, they think they're over the hardest part, and then within 1 or 2 days, they're worse than they ever were before, and they end up in the hospital, or worst case scenario, they actually pass away at home. So there are many more resources now that people need to be aware of. If you're feeling sick, if you're feeling run down, get help, get evaluated. There are now virtual services. A lot of providers offer virtual consultations. It's a Zoom call, almost like this. It's secure. Or you can come in person to your primary care provider or an urgent care. We have a lot in place to make sure it's a safe place for you to get evaluated. And just like Jeff Sherman said, a lot of our hospitals have many different treatments available. So if we catch you early and you fit the criteria, you can get on a great medication like convalescent plasma or remdesivir. So there's a lot of treatments out there, but people have to seek the clinical advice to get the information and the treatment they need.
That's good to know. So, Jeff, you were doing some videos. You mentioned that you were taking advantage of social media and FaceTime and everything while you were at Hoag. And we have one of those videos, if we can go ahead and roll that.
We have seen how packed local hospitals are with people battling COVID-19, and now we're hearing from one of those patients.
Yeah, he's recovering at a Newport Beach hospital. KCAL9's Jasmine Veal spoke with him as doctors continue to plead with people to take precautions.
And that's my airline way over there. That's running around and down and over the IV.
This is the room 46-year-old Jeffrey Sherman has been isolated in ever since he was admitted to Hoag Hospital on December 15th for coronavirus.
I've been having breathing issues since the minute I came in here, and I'm still struggling with that right now.
He is still hooked up to oxygen because he is still fighting pneumonia and taking blood thinners to prevent any clots.
You want to talk about fearing your own mortality, thinking that at any second you could take a breath and it could be your last. Is just mind altering.
Well, Jeff, we are so grateful that you're home and that you're on the road to recovery and that you got the care that you needed in time. And so we are just going to keep praying for you and hoping that you'll be back out living the life that you always have in the next month or so. But you know, as we tell people all the time, everybody is different. For some people, like you said, it's just a common cold, and then for others it's devastating and it's life-threatening. So I thank you so much for joining us tonight and being a part of this and sharing your story. And I think the more people that hear these types of stories, and they really understand and connect and know that this is real and this is something that we really need to take seriously. And everybody has COVID fatigue. I get that. But this is very much in our community. It's in our backyard and it's affecting our neighbors. So thank you so much for being a part of tonight. We're now going to transition to talk about the vaccine. And so there's been a lot of rumors, a lot of myths, but there's also a lot of facts behind the COVID vaccine. So I want to just take time to really kind of dive deep into this topic with Dr. CK. And so let's go to the next slide here. And so we know about the Pfizer and the Moderna vaccines, and we know there are others that are coming online. But let's talk a little bit about the background behind this. And Dr. CK, if you could kind of walk us through a little bit about the background of these two different vaccines that are currently available.
Right. So first of all, I want everybody to be aware that the vaccine is available at no cost. So if someone's offering you a vaccine for X amount of dollars, it's probably fraudulent. Please don't go to that provider. All providers who are delivering the vaccine have been approved. They go through a rigorous process to get approved by the state. And even if a provider is approved, it doesn't mean they actually get vaccines from the HCA or the state. We're trying to give the vaccine out in a way that's fair and equitable across our county. If a vaccine is delivered, there might be, if you do have insurance, there might be an administrative cost that typically is covered by your insurance, but for the most part, the vaccine is free. If you do not have insurance, it's free. And if you don't, so example, homeless population, when it's their turn, they will actually be able to get the vaccine, even if they don't have an address that they live at. So again, this is offered across our county when it is, a member's turn. Each of the vaccines require 2 doses, at least the ones that are out right now, Pfizer as well as Moderna. Pfizer requires 21 days between doses, and then Moderna requires 28 days. Now you can give or take for 4 days to get the second vaccine. And we're hoping that all the providers who are delivering the vaccine also will be the same providers who will deliver the second vaccine. In terms of reaching full efficacy, a lot of people hear about, wow, these vaccines are really effective. They're at 95% effective, which is actually unheard of. When you hear about the flu vaccine has an efficacy rate of about 60%. And even getting a vaccine doesn't mean you should stop your preventive measures, because it's not 100%. Nothing is 100%, but 95% is pretty darn good. And we were able to get to those numbers rather quickly because there was so much COVID in the communities that you can actually immediately see the efficacy of the vaccine when someone got it and when someone got placebo. So it's actually really good news.
That is great news. So let's kind of talk a little bit about the safety. We know that they're effective, but let's talk about the safety, because that's on a lot of people's minds right now. And even, some of my best friends are saying, well, I'm going to wait 6 months to make sure that it's safe. So there's been a lot of testing to prove that these vaccines are safe. So let's talk a little bit about that. So the first question, as I said, a lot of people are concerned that they feel that this was developed in record time. Maybe corners were cut. They don't trust it. So maybe we could talk a little bit about that with the next slide, some of the facts behind how this vaccine was developed.
Right. Our nation actually has a really good process when it comes to figuring out safety, efficacy. We have clinical trials, phase 1, which is usually developed to look at the safety profile of any new medication or vaccine. And then phase 2 is actually looking at the effectiveness of that vaccine. And then phase 3 is actually larger portions of the population that are studied to look at both safety as well as efficacy. And in terms of the phases, the number of months that were actually taken to look at all of these phases was actually appropriate. And the difference between these vaccines and previous vaccines is that the manufacturers did not wait until all the studies were completed before they started manufacturing. They were instructed at phase 1 trials to start manufacturing. So we sped everything up, and on top of that, all the companies were told, start making and manufacturing. You're going to get the support from the government, in one case, Moderna. And then, the other company was doing it even outside of that. But at either end, while all the studies were being performed, they were able to make this vaccine. And this vaccine is a little bit different in that it contains mRNA. It's not harvested in a cell. It can be manufactured at a rapid pace. So we have that luxury this time with science to be able to create a vaccine at rapid speed. However, we did take the time to study appropriately, and we're continuing to study even after the EUAs were approved. And this is also what's so important, that everybody who receives the vaccines also reports any side effects that they may have in relation to the vaccine.
So I want to go ahead and advance the next slide here, so that the next slide, one more, so that one more, to talk about what Dr. CK was just talking about the speed of what this vaccine was developed and all of the studies that went into it. And fun fact, my brother-in-law was actually part of this study, and you mentioned in one of the bullet points using social media, and it wasn't easy to be a part of the study. My sister applied, my brother applied, and my brother-in-law also applied, and he was the one who got in. So there was a overwhelming number of people that wanted to be a part of this study. And we still don't know if he got the vaccine or not, because they haven't told him yet. And we're waiting. We were told that he would find out in April. And so it's really fascinating to see this whole process develop, and to see that this came to fruition so quickly. But I think it's important to know that it was done safely, and that's really the key thing, is that people didn't cut corners, and there was the funding behind it to ensure that these drugs could be made in rapid time. So I think that that's really important for people to know, that this has been developed safely.
And if you remember, before the EUA actually was granted, the FDA took its time through that weekend to really review. We had a lot of specialists and experts who were on the panel reviewing all the data once it was finally released, to determine if we can actually have an emergency use authorization for this vaccine. And while other countries may have sped through and approved it, the United States actually held back and went through the process to make sure all the experts really took their time to review the studies before they granted the EUA.
Mm-hmm. So let's go on to the next question that I get a lot, and that is, can the vaccine give you COVID-19, or does it make you test positive for the coronavirus?
So the vaccine actually gives you gives the body the instructions to make the spike protein, that red spike that you see on all the pictures of COVID. And this actually does not give you COVID, although, as you saw, when you get the first dose or even the second dose, it's not 100%. You can still get COVID from the community or from loved ones. But the good news is, with the studies of both Pfizer and Moderna, is those people who received a vaccine and still got COVID had either no symptoms or very mild symptoms. And this is where you get that high effectiveness of the vaccine. So even after the first dose of Pfizer, we saw that you actually have a 57% efficacy rate, which is really good. And even Moderna has a very similar efficacy after the first dose, but it still takes time. And again, it's so important to get the second dose for you to reach the full 95% efficacy rate that was seen in the studies.
And I think that's important to note, that even if you get the vaccine, you still have to wear a mask. You still have to practice social distancing. You still have to wash your hands all the time, because, like you said, it's 95%. You could still theoretically get it. And actually, we know of a congressperson here in Orange County who did have both doses and did get COVID, but he said his symptoms are mild, very mild. So
right.
I think that's important for people to know, that even if you've got the vaccine, there is still a chance that you can get it.
And efficacy, really what we're looking at efficacy is that you don't have the severe effects of COVID. So you may still get COVID, but you're not going to get the severe effects that cause hospitalization and death.
So let's move on to the next question, which is something that I see a lot on social media, and it's that, are these types of vaccines safe, and can they change your DNA? Because as you mentioned, it's a different type of vaccine than, say, different ones that we've received in the past.
Right, so mRNA stands for messenger RNA. It's a single strand of instructions that is read once by the body and is pretty much discarded after it's read. It is not part of the DNA. So that's the beauty of this. It does not change your DNA. There may be other vaccines that may actually help with the DNA structure, but this one does not. So this one is just read just to make the spike protein. The cell then puts that spike protein on its surface so that other immune cells can recognize it and be able to create either immunoglobulins or antibodies against it the next time it sees it, or can identify it to be able to destroy any cell that has that spike protein. We just don't know how long that antibody or that immunity lasts after you receive it. So more to come. We're hoping that these memory cells will, be around in the system for a long time, so we won't have to redose.
And I think that's something that a lot of people are concerned about as well, is that, well, if I get the vaccine, is it good for 6 months? Is it good for a year? If I get the vaccine, can I get on the next flight to Hawaii? I mean, those are all the types of things that we just don't know yet. And as we start to learn more, it's a novel virus. So let's go on to the next question, which is a lot of things that people, I hear a lot as well, is that, well, if I get the vaccine, am I going to get sick? Am I going to get worn down? What can I expect if I do get it?
So the most common side effect is pain at the injection site. About 80% pain in the injection site. But when you look at the placebo group, they also report about 50 to 60% of them also report pain at the injection site. You can actually get fever, muscle aches, and fatigue and headaches. I would have to admit, though, that pain in the injection site is pretty significant for those who actually get the pain in the injection site. So I've seen people who had actually no symptoms whatsoever following the vaccine, and some people who have a really sore arm for about 2 or 3 days, but usually goes away after 2 or 3 days. In terms of the fever, we're seeing this more so in the second dose of Pfizer or Moderna, but we do still see it with the first dose. Usually it's a mild fever, but some people can actually have a high fever. And in that situation, we do recommend take an antipyretic like Tylenol or Advil. For muscle aches, again, we usually recommend some warm packs and take it easy. And yes, we have seen people have fatigue for a couple of days, but usually it's very limited to about 2 to 3 days.
So 2 to 3 days, but just something that keep in the back of your mind, that could be, but more on the mild side.
Right, and because these are new vaccines, VAERS, which is a reporting system for the United States, is recommending that anytime you have any symptoms, you go ahead and report it, even if it's
mild. If I have a headache, I should report that.
You should report it. And there's many different applications to use. Mm-hmm. If the provider who gave you the vaccine used Othina to log you in, strongly recommend using Othina to go ahead and log your symptoms. You can actually answer daily what your symptoms are. And then from there, I'll ask you if you want to submit this to the state or to VAERS. So you can submit it that way. If your provider used a different mechanism, there's something called vSafe. vSafe is another application that you can use similar to Othina to report your symptoms directly to VAERS. Other option is just directly go to VAERS, and they have a website, they have a phone number, but it's at the back of each of the cards that you'll receive when you get the vaccine. And again, any symptom that you have. So it doesn't have to be severe, it doesn't have to be moderate. It can be any symptom.
Good to know. The next question that we've been asked is, will the vaccine cause infertility?
So, at this time, what we know about the mRNA is it creates that spike protein, which has no relation to any of the cells related to a fetus or the egg or the sperm. So at this time, no, we do not believe it causes infertility. And actually in the studies, there were some women who actually did become pregnant and have received the vaccine and did conceive. So that's really a positive. I know there's a lot of things online about, it's this syncytial protein, completely different, not at all similar to the spike protein. So I think that is misinformation on the website and in the media. But at this time, the short answer is no, it does not cause infertility.
That's perfect. And what I just want to remind everybody that I know there's a lot of text on these slides, and this PowerPoint presentation will be uploaded so that you can go back and reference it as needed, because there is a lot of detail, and Dr. CK is doing a great job of highlighting all of them, but I know people will have additional questions. And so I just want to remind people that that information will all be made available for you. So let's go to the next question. And this is something that I get a lot of emails on, being an elected, is there a government mandate to get the vaccine?
No. However, as with
always that however, right?
So in the future, this is where, certain organizations, I can't speak for them and what they're going to decide for their employees. We don't know. We don't know if in the future some employers may decide to mandate it. But as far as the government, there is no mandate for this vaccine.
Right. And I think that's important to note. And like I said, I get that question a lot about, is there a government mandate? And right now the answer is no. And as you mentioned, a private employer, that's something to be determined if they decide to do something. But right now there is no mandate. So let's go on to, is there anyone who shouldn't get the vaccine? As we talked about some of the, the side effects, but is there a certain type of person that maybe shouldn't get the vaccine?
Yes, and I'm so glad you're bringing this question up, because we're actually seeing this question a lot at the pods. So if you have a known allergic reaction to Miralax or polyethylene glycol, it's something that's commonly used in laxatives or the colonoscopy prep. What we do know is that there's some cross-reactivity to the protein, the layer that surrounds the mRNA. So at this time, it is a contraindication if someone has an allergy to Miralax. The other one that's not mentioned here is polysorbate. Polysorbate is actually found in a lot of cosmetic items, as well as ice cream. It's like a thickener that's used in some of the food items, and sometimes it's in actually vitamins. So those are the two big ones that if you have a known allergy to those two, at least at the super pods, we're going to recommend that you not get the vaccine. If someone wants to consider it, even if they have these allergies, this is where I would refer them back to an allergy specialist. And then also, if you recently had a vaccine, right now we really want to make sure that if you're going to get the COVID vaccine, do not get it in or around another vaccine, because we want to make sure your immune system is going to be prepared to make the immunoglobulins specific to this vaccine. So if you just recently had your pneumonia shot, your flu shot, give it at least more than 14 days before you get your COVID vaccine, and try not to get a vaccine less than 14 days after you received your COVID vaccine. Mm-hmm. In terms of advanced COVID-19 treatments, it's not a contraindication, but there's some people who are receiving monoclonal antibody treatment from their provider, or they recently received convalescent plasma from their COVID infection. You can still get the vaccine, but it's recommended to wait at least 90 days before getting this vaccine. So that's a discussion that should occur with your primary care provider or your specialist who's helping you with that. In terms of pregnancy and lactation, there's just not enough data, not enough studies for those who are pregnant and lactating. But what we do know is that the mRNA protein, it doesn't pass the placenta. And what the American College of OBGYN is recommending is they are strongly recommending that if a female who is pregnant or lactating desires to get the vaccine, that they can get it. Because the idea is that because this vaccine doesn't cross the placenta, the good news is if the mother's body appropriately responds and creates the antibodies, the mother can actually pass those antibodies to the fetus or to the baby that they're breastfeeding, which is great news, because again, even getting this vaccine doesn't prevent you fully from getting COVID, but in the event that you have it and you have the antibodies that you're delivering to your child or your fetus, I mean, that's great news that you can actually protect your child.
That is great news, and I didn't know that, so that's great. So let's go on. We sort of touched upon this a little bit earlier, that if I get the vaccine, I can just go and live my life. But we really are discouraging people from that because of all the things that we've mentioned before. But if we want to just touch just briefly upon that.
Yes, I mean, we're hoping that most of the population eventually gets this vaccine and that we can get some sort of herd immunity. But until then, honestly, we all need to continue to take the precautions. So I'm sorry, it says likely yes, but that likely yes is not until we've met herd immunity. Until then, we should all use all the precautions, from the distancing, the physical distancing, to wearing the mask, using the hand sanitizer, making sure your hands are clean and being careful about what you're touching. Those are all so important. We're also seeing the importance of this. It's what we practice on the regular basis in the hospital.
Right. So now for the last one, just really about the vaccine. If I want to get more information about the vaccine, where should I go?
So we recommend that you go to trusted resources. So either the CDC, Moderna, Pfizer, a lot of the public health websites, including the Orange County Healthcare Agency website, or we're actually promoting Athena because we're trying to put a lot of information in that app. So if you're still waiting for your turn, there's a lot of information that's directly from the CDC that is on the app.
Perfect. Okay, so now we're going to talk a little bit. We know a lot about the vaccine and the history of it, the effectiveness of it. And so now is the $1 million question is, who's eligible and how do I access the vaccine and what the heck is Athena?
Yes. So who is eligible? We started out with phase 1A as per the state and the nation's recommendation because we knew that we had to protect the healthcare workers who are caring for people like Jeff Sherman in the hospital, in the urgent care setting. We do have to protect them so that they can help us when we get sick. And then we also need to protect other healthcare workers who are at high risk. So that's phase 1A. And again, phase 1A is actually those who have direct patient care. So there's a lot of people in the health industry who actually are not delivering direct patient care. While you may think you're in phase 1A, technically you're not if you don't have direct patient care. So we recommend that those who are in that group, please allow those who are in the front lines to get their vaccine. There's such a limitation in how much we actually get. We recently opened it up to 65 and older because when we saw the data from the hospitals and what's keeping us in our lockdown, we realized, wow, most of the people who are being hospitalized are over the age of 61. And most of the people who are in the ICU and on ventilators also are above 61. We're talking 71%. So if we're going to even get close to getting out of this lockdown, we have to really prioritize those vulnerable patients in our communities, the 65 and older. So last week, we actually increased the eligibility to involve 65 and older. We're going to try our best to prioritize, and you're going to probably see this tomorrow, so you guys get the news first. California is looking at really prioritizing first 75 and older, and then after that, anyone 65 to 74 with chronic conditions, and there's going to be a list of specific chronic conditions. And then the third priority after that group is going to be everybody else 65 and older. And then after that is the rest of phase 1A.
Okay, so let's go to the next slide real quick because we have a little bit of a breakdown of that. As you mentioned, for 65 and older, and then the phase 1A population, and then the law enforcement in high settings. And let's go to the next slide here. Real quick here about being eligible, and you have to work and live in Orange County to be eligible. And then, as you mentioned, all the different because there is confusion about who is eligible. And then, as you mentioned, it's not just that you're eligible, there'll also be priorities within that eligibility. So you may be at 65, but if you are, if you have, say, a health condition, a heart condition or something, maybe you get bumped up. Or if you're 75, you're going to be bumped up over somebody who's 65. And I understand the thinking behind it because what we're really trying to look at is who is most likely to end up in the ICU. And right. So if we can make sure that those folks don't end up in the ICU. Let's vaccinate those folks, and then we will continue to go down the list. And so, like you mentioned, the data has been showing that people over a certain age have a higher propensity to end up in the ICU. And if we are ever going to get out of this lockdown, we need to free up the capacity at the ICU. And so let's focus on the individuals who are most likely to end up in the ICU. So that's the need for the priority list. And it's It's confusing, I think, for a lot of residents when they hear it's 65 and over, and then they're not able to get this appointment. But I just wanted to talk a little bit about that eligibility. And so we have on the slide here, you must live in Orange County, and if you want to find out if you are eligible, you can go to these sites to learn more about the prioritization and who's going to be next.
And just remember, when you go to especially any of the pods, and even your local hospitals are also offering vaccine, local health systems and some community clinics, you really should bring some proof of eligibility. So bring your driver's license, hopefully with your Orange County address. If you work here, bring something that shows that you work here. We really need you to try to bring as much identification as possible, because again, all these clinics, all these hospitals who are delivering this vaccine are put under a lot of pressure to really meet the criteria. We're trying to be really fair, and we're trying to really, again, offer the vaccine to the highest risk in our communities. And it's really important for us to make sure that we are verifying eligibility as well.
So let's go to the next slide. And this really is, when I do become eligible, how do I get the vaccine? And this, I think a lot with my mom, who's in her 70s, and I want to get the vaccine for her. So she's eligible. How do I get it for her?
So there's multiple ways. One of the ways that HCA has really committed to improving access is we went to Othina, which is an app developer company, because we wanted an end-to-end solution. We want to be able to communicate to the public where they can potentially get their vaccine, and also alert them when their next dose was, because we cannot mess up on the second dose. We can't mix Pfizer with Moderna. We also wanted an app that can report out to VAERS. And so to have all of that under one app was asking a whole lot. I know that there's other mechanisms that we can report out, but again, we wanted an end-to-end because we want to resurrect a lot of clinics and give options to patients of where they can go for their vaccine. So you can go to othina.com. You can also download the app on either Google or Apple. So yeah, you can go on the website. And I know that there's a lot of people who do not have technology. What we're trying to do is we're working with senior centers, and we're working with libraries to have some access points, to have some people help those individuals get an appointment. Other ways of getting an appointment is also reaching out to your primary care clinician or your healthcare system. They will have certain clinics available to the public, to only those who are eligible for vaccination. And we've been in talks with many of the big health systems, and they're planning and strategizing how they're going to, deliver vaccine to the 65 and older.
Right. So there'll be a multiple of different types of distribution systems available. It might not just be what we've seen, like these super pods. There'll be, like you mentioned, doctor clinics, medical clinics, the senior centers. There'll be different avenues to get the vaccine.
Right. I want you to go back to the previous slide, if it's possible. Because we've heard from the community, we've heard the frustration about, I can't get an appointment, and people are next to their phone and their computer and clicking to try to get that appointment. We're actually changing the system so that people will actually receive an email and to offer the appointment if they are in that eligible group. And again, we're trying to prioritize by age. So this means people don't need to stay near their computer or their app and continue to click. The app will actually invite you. So hopefully that will alleviate some of
if I'm a person who's eligible, I should go on to either the app or the website, fill in my information, and then I can expect to get some sort of email notification saying that now I'm eligible and I can register for an appointment.
Correct. And just realize there's such a limitation of the vaccine. And I'll give you an example. Once we opened it up to 65 and older, we were looking at a population of over 600,000 who are now eligible for the vaccine. We've only had approximately a little bit over 100,000 who've been able to get the vaccine into their arm. And just this week, we just had about 43. I mean, at first, we started the week off thinking we had 46,000 to play with and to deliver to the population, and we actually had a little bit less than that. And next week, our allocation is a little bit lower, 30,000. So that's just too little, right? If you have over 600,000 who want this vaccine or who are eligible, that's just not enough vaccine to cover everybody. So we're asking for everybody's patience. And we're trying to use the technology to be able to prioritize by age, as now will be recommended by the state. And we're really asking for everybody in the public to just be patient with this and really make a lot of noise. Talk to the state, get the word out there that Orange County wants to be vaccinated. We want vaccines. Tell our new president, we want vaccines. Give us more, because we want to be able to vaccinate our community.
And I think that plays in well to what the county's goal is, as well as this Operation Independence. And so can you talk a little bit about the goal of Operation Independence that the county has outlined, and why we should be demanding more from our elected officials to get more vaccines here in Orange County so that we can hit our goals?
Right. So we call it Operation Independence, and this is Dr. Chow's goal. He said, by July 4th, I want to be free of this pandemic. And so the only way to get there is to vaccinate most who are eligible by July 4th, because then at least we have promise of hopefully getting into herd immunity. We can get back to our regular lives. So that's why it's called Operation Independence. When we did some of the stats, we realized, wow, if all these vaccines actually require 2 doses, in order to reach that, we actually have to be vaccinating over 30,000 people a day. That's a lot. And I just told you, we barely got 46,000 this week. That's not even cutting it. We won't get there. So we really need everybody to rally and tell their elected officials we want vaccine. We have seen other counties show us that there was a lot of vaccine hesitance. What we're seeing here in Orange County is quite the opposite. We see it when I think the first day when Othina opened, we had over 200,000 all at once wanting those vaccines. I think there's over 104 million interactions with the app in that first day. That's a lot. So we know a lot of people want this vaccine.
Well, and we'll do everything that we can here at the city to talk to our elected officials up in Sacramento and at the federal level to get more vaccine here in Orange County so that we can hit our goals and have obtain that goal of Operation Independence, because we all want our lives back. I completely agree with Dr. Clayton Chow. He couldn't be more spot on. So let's talk a little bit about the Disneyland Super Pod that we have heard about in the, I guess we could talk about what is a point. We should probably explain what a pod is.
A pod is a point of dispensing. So it's just a site where we would deliver a lot of vaccine. And, when we realized, wow, we really got to vaccinate 30,000 a day. When you look at how the hospitals are so taxed with the surge of COVID, I mean, all those nurses, those clinicians, those healthcare workers are really tired. As you heard from Jeff Sherman, they have PTSD from this all over their face. They're working extra shifts. And to ask the hospital systems to be able to deliver efficiently on vaccinating the majority of our community is asking a little too much, right? We need to make sure that they're focused on taking care of the sick. So we know that it takes a lot of administrative effort to vaccinate a high volume of patients. And so we immediately resurrected our first pod, Disney, of all things. Of course, we want Disney to be that first, happiest place also delivering vaccines so we can get independent from COVID. And what the super pod is we're aiming to vaccinate actually 7,000 to 8,000 a day. We started out with 3,000 a day. We were able to get up to 5,000 a day. Because of the winds, we did have to put a halt because we wanted to make sure people were safe. Some of the tents actually blew over. So I'm so sorry for those of you who had to get your appointment rescheduled. We're just looking after your safety. So all of those patients who were scheduled in the last 2 days have been invited for an appointment in the next 2 days. But we are aiming to open Disney tomorrow. It will be open tomorrow, and we are looking to open more pods throughout the county. So as you can imagine,
and those pods will be regionally located. So if I live in San Clemente, I don't have to drive all the way to Anaheim or.
Right. Our hope is that we're going to have a pod open in different areas of our county so people don't have to drive such long lengths to get to a pod. Now, these pods are not for everybody. Obviously, there are lines which we've gotten down from the first day. We've gotten it down to about 30 to 45 minutes, depending at the time of day. We recommend that everybody who's going to any type of super pod, or even our mobile pods, our pop-up pods, that they come in about 15 to 20 minutes before their appointment time. If you come sooner, expect to wait. And we know that we don't want people waiting in the sun too long. So again, do not arrive more than 15 to 20 minutes ahead of your scheduled appointment time. We want everything by appointment, because the last thing we want is even more lines and more confusion. And on top of that, with these pods, we only have a select amount of vaccine. So, we again don't want people walking up for vaccine that we may not even have to give them. The entire process takes anywhere from 45 to 60 minutes, but hopefully we'll get it down to 45 minutes.
So not a question that we've been asked, but a question that I have and that I've been hearing is, do most people show up for their appointment? Are you finding most people are there? I mean, I hear stories in the news about vaccine that's being thrown out at the end of the day because people didn't show up for their appointment, but that's not the case in Orange County, I would imagine.
That is not the case. So I have to admit, I know on Reddit, there's a lot of people saying, stick around the pod after a certain hour, you're gonna have leftover. We no longer have that problem because we've figured out our appointments. It was the first day that anytime a clinic is open, we don't want us to waste a single drop. And unfortunately, when the word gets out that we have it, a lot of people swarm and want that vaccine. So we've got it down to a science where we will not have an extra drop. So don't wait around to walk in. It's not going to be available to you. We have an adequate amount to just vaccinate those who are there for their appointment.
Okay, that's really important for our residents to know, because as you said, it has been circulating on the internet that vaccines are being thrown away. So now, one thing about Huntington Beach, and this is something that we've seen, whether it's our homeless shelter, we have a community that's very giving, and they want to volunteer. They want to help. And this community comes together like no other community, I believe, in Orange County. So how can people help that want to be a part of this historic process?
So we need volunteers, because as you had mentioned and I'd mentioned, we are going to open up pods throughout the county. So we need to create a database of volunteers, medical or non-medical. We welcome anyone who can help direct lines and help direct traffic. Also people who are tech savvy and can help with registration. People who can translate, because there's a lot of translation needs that we do have. Clinicians, MAs, healthcare workers. We need everybody, but we do want this to be a very safe pod, which means we do have to do a little bit of homework. We do have to do some vetting of the volunteers. So for those who actually volunteer, we recommend that you go on 1OC. I believe it's 1OC.org. It will ask you questions.
There we go.
Okay, perfect. Or this website. There's going to be a lot of questions. And yes, if you're a medical provider, it's going to ask for your license. Because again, we want this to be a safe environment to receive the vaccine. And we also want to be a safe and secure environment to make sure everybody who enters a pod feels safe. So we really need a lot of volunteers, and we know that Orange County already has been stepping up. We've had a lot of wonderful volunteers who came from all parts of our county over the last few days. And I want to also recognize the fire department as well as the city workers who put a whole lot of hours before we even stood up our first pod. There was a lot of hours spent through the holidays. A lot of us who are working to create these pods. didn't have a holiday. There's been a lot of long hours. So special thank you to all of those, city of Anaheim. I know there's a lot of other cities, so I'm so sorry if I didn't mention you, but I know that there's a lot of other cities that helped out with the different fire departments. And of course, our firefighters and our EMTs and our paramedics who also helped to make this successful. Thank you.
And I echo that. I know here in Huntington Beach, our fire department has been on the front line from the get-go, and our own city manager, Oliver Chi, he has been part of the vaccination task force. And so I say to our fire department and to our city staff, they haven't had a day off in a year, and they work every single day. So I have time for a few questions if you're up for it.
Yes.
I have 6 questions. We'll try to get through as many of these as possible. These are a little bit more specific because these are coming from the residents. So the first question is, what does it mean when you're in the Athena waiting room? And I know that's technical replying to the app.
Yeah, it's a virtual waiting room. So basically the app, I believe after tonight into tomorrow, when we go into the age-based tiering, it's going to prioritize you by your age or your category, if you're phase 1A, and the timestamp of when you actually registered. So it's an algorithm that we use to make sure, again, that so obviously if you're 75 above, I'm hoping that the algorithm works so that you're going to see that the 75 or above are actually going to be offered an appointment ahead of someone who who just turned 65.
Right.
So there's a lot of development on the app. There's a lot of challenges we've had that we've been working through, and you're seeing that we're improving every day as we go forward. So that's what that means. It's a virtual waiting room. Hope is eventually when we have plenty of vaccine, that have a virtual queue that if there's extra doses, we immediately notify the next person who's around, kind of like Uber, so that you'll be notified. There's an appointment. That's actually how it's supposed to work. But right now, it's not enough vaccine.
So if somebody is struggling, the next question is with the Athena app, and they're having technical difficulties, is there a number that they can call? Is there a helpline?
Oh, I'll need to get back to you on that. So we'll have to post on the updated PowerPoint. I don't want to give you incorrect information.
Sure. So the next question maybe you can answer is, why can't the vaccine be distributed first to the areas that have the highest transmission rates? I know you mentioned equity earlier. So why isn't the vaccine distributed to those areas with the highest transmission rates?
So it's a complex question, right? Because we do know that some people actually work in certain areas and actually don't live in those high risk areas. And then there's certain jobs that actually put you at higher risk. So I know with the law enforcement, we were very specific about the law enforcement who were working in Anaheim or in Santa Ana were actually given the opportunity to be vaccinated because we knew those areas were having a lot of outbreaks. Also, the homeless shelters and the correctional facilities in those in Santa Ana were also given vaccine. It's really hard. I wish I could say, yes, we can only give it to these communities, but we know that it's also in many other communities. And we know that people who may live in Anaheim actually work somewhere in Southern Orange County. So we want to make sure it's open to all, but we are trying to make some efforts to focus on the outbreak areas.
Okay. Question number 4 is, do public officials get the vaccines before the elderly?
I hope not. And I'm hoping that
I haven't got it yet. No.
You know, I'm sure there's going to be people who received it and it doesn't make any sense. We're trying to really focus on clinicians and healthcare workers, everybody who's delivering the vaccine. We're trying to tell them, please give it to the eligible, the high risk populations. But, you know, it's hard to police that. But we're all trying to do our best to, again, give it to the vulnerable population first.
Yep, I agree. Number 5, is it true that your second injection has to be from the same lot number as the first?
It has to be from the same manufacturer, not the lot number. The lot number will always change. So usually lots are by batches. So if you just think of, I guess, a cereal company or something that's made in a manufacturing plant, on this given date, this batch was made and that's a lot number. You probably won't be able to get the same lot for your second dose. It'll probably be a completely different lot. But we do not want you to mix Moderna and Pfizer. If you get Pfizer, you should not get Moderna, and vice versa. If you get Moderna, you shouldn't get Pfizer, because we do not have any studies to prove the efficacy if you get only one of each. It was only studied for the 2 doses of that specific brand.
And so when you get the shot, you're clearly told which one you're getting and told when to come back.
So when you go to a provider, they should write it down on your card. And also the provider is supposed to report it onto CARES, which is the California Immunization Registry.
Okay, and the last question is, if you got your first shot and you're due for your second shot, do you get priority?
So those are completely separate. So usually the allocations for the second lot are completely different than the first when it comes to hospital systems, HCA. So if you received your first shot, we recommend you go to the facility or the health system or the provider who delivered your first shot. Because one, they will have the record of what you received the first go around, and they'll have the date and everything else. For those who are going to the super pods and using Othena, I know that some people went to the fire departments for their first vaccine. And what we're going to do with the second appointment is we're going to offer an appointment in one of the super pods for the second dose. So for those of you who are going to the fire pods, please do not bombard them, because they now are not open to the public when it comes to vaccine. We're, again, reprioritizing to the super pods.
Okay. Well, I want to thank you so much, Dr. CK, for your time. I want to thank Jeff Sherman for sharing his story with us. I want to thank OC Healthcare Agency for helping coordinate all of this, and then always the City of Huntington Beach and the staff that we have here. They're just absolutely amazing. And we're going to have these town halls every other Wednesday, as we mentioned, through April, to really give our residents the most up-to-date information on what's happening with the vaccines, how they can get vaccinated, and how we can really, be a partner and give our residents the information that they need. So thank you so much, Dr. CK. I learned a lot, and I know that our residents did too. And I just want to remind everybody that a couple of different websites, obviously hbready.com, and then Dr. CK, if you could give out the county's website again.
Actually, there's many different ones. OC Health or
/COVID.
Yes.
Those two websites. But again, HB Ready is a great catch-all where we have up-to-date information about COVID, and to log on to that Othena site to learn more about your eligibility and to get vaccinated, and really to get us back to normal. I think as you mentioned, Dr. Clayton Childs said, we just want to get back to the life that we had and be a part of this whole Operation Independence. So thank you so much to everybody who participated tonight to make this town hall successful. And again, we'll be doing this again in 2 weeks with more updated information. And as we know, this information changes daily. And in the meantime, we're going to, rattle the cages and demand more vaccine for Orange County.